Hello and welcome to National Focus. I'm Pearl Fontaine. Thank you for joining us. Topping the headlines, Dominica takes action to reduce healthcare-associated infections. Regional insurance representatives challenged to develop a health insurance scheme for Caribbean citizens, and hundreds of state college students receive hands-on training for the world of work. Stay with us for details of these and other stories after the break.
The Ministry of Education and Human Resource Development presents Math in Action, making math interesting and fun. Our master teachers will help you improve your problem-solving skills so that you can ace that exam, helping you conquer the most difficult math problems. At any level, we'll make it simple through easy-to-follow tutorials. Join us every week on the Government Information Service for Math in Action, brought to you by the Numeracy Task Force of the Ministry of Education and Human Resource Development.
Documentaries and in-depth discussions, community walkthroughs, and Yes We Care. See it all on GIS Channel 7.
Welcome back. Dominica is taking action to prevent healthcare-associated infections at health facilities on the island and to reduce the costs associated with preventable infections. On Tuesday, the Ministry of Health, in collaboration with the Pan-American Health Organization, PAHO, began a 3-day regional workshop on the surveillance of healthcare-associated infections. The workshop, which is being held at the Garaway Hotel, has attracted participants from countries across the region and is the first such workshop of its kind to be held in the OECS. Dominica's Health Minister, Honorable Julius Timothy, fully endorsed this week's workshop. The minister, in his remarks, highlighted that babies as well as cancer and diabetic patients are at the highest risk of getting healthcare-associated infections.
Healthcare-associated infections, also known as nosocomial infections, are defined by the World Health Organization as infections occurring in a patient during the process of care in a hospital or other healthcare facilities which are not present or incubating at the time of admission. These infections, acquired in the hospital but appearing after discharge, and also include occupational infections among staff of the facility. Healthcare-associated infections can affect any patient and can occur in any type of healthcare facility, but the highest risk is for young babies, especially premature babies in the first month of life, patients admitted into intensive care, and those who are immunocompromised, such as cancer patients, patients with diabetes, patients taking medications that suppress the immune system, and the patients with HIV.
The health minister, in his remarks, said healthcare-associated infections is a growing concern not only in Dominica but the wider region and must be addressed with a level of urgency.
The ongoing occurrence of healthcare-associated infections and recurrent outbreaks in healthcare settings are important signals that there is need to focus on the issue of infection prevention and control in order to improve patient safety. Here in Dominica, we recognize that these infections represent a challenge that requires immediate, strong, and sustained attention.
The island's Chief Medical Officer, Dr. David Johnson, says this latest initiative by Dominica to prevent healthcare-associated infections is in keeping with new international health regulations.
Quite apart from our obligations under International Health Regulation 2005, we all have a responsibility to improve the systems that we have in place in minimizing healthcare-associated infections, which affect our patients under our care and, to a lesser extent, our own healthcare providers. Strong institutional commitment is therefore vital in achieving significant behavioral changes as we move forward in strengthening our surveillance systems. Clearly, there has to be a greater effort by all of us if we have to achieve the goals we set for ourselves.
The Pan American Health Organization has provided a team of international professionals to facilitate this week's workshop. PAHO Regional Advisor on Health Surveillance and Disease Prevention, GIS Dos Santos, is one of the individuals in Dominica providing support to the workshop.
The objectives of this training are to strengthen surveillance systems for healthcare-associated infections, and we will do that by presenting and discussing the main methodologies of surveillance of healthcare-associated infections and how to analyze that data that is generated from that surveillance. This training will be participatory. There will be some presentations, but many exercises, a lot of time for discussions. So we really would like to invite you to speak up, to say your concerns, and to share with us our experience, because we all learn from that experience.
To complement this week's workshop, the Ministry of Health is also in the process of putting together a national infection prevention and control manual. In more news, Dominica is this week host to the 27th Congress of the Caribbean Association of Insurance and Financial Advisors, CAREFA. The Congress, which got underway here on Monday, is being held under the theme Life's Blessings. The Congress brought together over 100 insurance representatives from a number of insurance companies across the region. Prime Minister Honorable Roosevelt Skerrit, in welcoming the delegates at an opening ceremony on Monday, commended CAREFA for the leadership shown in the insurance industry.
Clearly, we have been visited with some unfortunate instances, but I believe generally the insurance industry is a very responsible one. And I want to commend all of you for maintaining that level of professionalism in the industry.
The Prime Minister challenged the insurance delegates to look at strengthening regulations as a means of safeguarding the financial assets of the region's people. The Prime Minister used a recent situation in Cyprus to illustrate his point.
Even with the situation in Cyprus, I'm sure many of you have taken keen notice of this levy on people's accounts in Cyprus. What would that mean for we here in CAREFA if that were to happen in the Caribbean? What would that mean to reinsurance and insurance to citizens of the region if that were to happen in this part of the world? Because you, in fact, are custodians of several of millions of dollars of citizens' money. And somebody were to come in overnight and take 15% of this away. What would that mean for many small insurance agents and insurance companies across the region? So I believe you need to discuss these things during the next few days that you're here, and to advise us on the impact this will have on the region, because this is something that we have to guard against as a region, and you have to assist in leading the particular charge.
On the issue of health insurance, Prime Minister Skerrit has suggested that CAREFA meet with government representatives, trade unions and other stakeholders to model a health insurance scheme which will be of benefit to Caribbean citizens.
My proposal is that I believe you in CAREFA, the governments and the trade unions and the employers federations of the respective countries, we need to meet and to discuss this very important issue as to how can we develop and model an health insurance scheme to benefit the whole population. Because governments just cannot afford to provide the extent of medical services which our citizens need nationally and indeed regionally. In every of our countries, everyone, with no exception, governments, and in fact you, the insurance friends, have to airlift people out of the region for medical services.
This is the third year that Dominica is hosting such a Congress. The government of Dominica is committed to reducing the rate of infant mortality on the island by the year 2019. That assurance has come from the island's health minister, Honorable Julius Timothy. The health minister made reference to this when he addressed a surveillance of healthcare-associated workshop on Tuesday.
Our infant mortality rate rose to 29.9 per thousand births in 2011. Most of these deaths associated with prematurity and infection. As a result, the government of Dominica, with funding from the European Union, has embarked on a project to reduce infant mortality to 10 per 1,000 births by 2019.
The minister cautions that while the rate of infant mortality will never be at zero, the Ministry of Health, through its healthcare providers, will continue in its efforts to save the lives of premature babies.
I think we should inform the public that infant mortality will never be zero. There is always a level of infant mortality, especially as the premature babies, whereas before we would set aside certain premature babies, now we try everything to ensure that these premature babies survive. So, notwithstanding the figures you have heard, I think we have to congratulate our healthcare professionals at the Stronach Ward in their tremendous efforts to save premature babies.
The minister has revealed that a newly introduced monitoring system at the Quality Assurance Department at the island's main hospital will assist in the reduction of deaths among premature babies.
Immediate and urgent attention has already commenced to address the issue of infections among babies, whether acquired in hospital or elsewhere. A new system for the monitoring of practices and procedures intended to minimize the acquisition of infections has been implemented by the newly formed Quality Assurance Department at the Princess Margaret Hospital. And this has already been showing improvements in the maintenance of the required standards. This system supports the work of the Infection Control Department, which has been working steadily over the years to minimize nosocomial infections and identify and respond to outbreaks where they occur.
The minister is convinced that Tuesday's workshop on surveillance of healthcare-associated infections will further assist lab technicians and policymakers to make informed decisions about infant mortality. In more news, the Dominica State College, DSC, is moving to make its education strategy one that is student-centered. And according to the institution, one way of doing so is through the DSC's internship program. The objective, says Dr. Donald Peters, president of the DSC, is to make the college learning process useful to students in more ways than one.
One of the things that we have gradually introduced in here is something called student-centered learning. It is a difference from chalk and talk, which is how we used to teach people before. Universities today want to make sure that when they train a student, that they are able not only to quote theories for you, but they can actually do hands-on work. And that is certainly a part of our future teaching methodology. Most of our younger faculty can do it. Some of those we have to work with and train them on how to do student-centered learning. I am back in the classroom. I teach 2 courses, so we are trying to utilize all our faculty to ensure that our students have what we call work skills and ready skills.
According to Dr. Peters, this strategy by the DSC corresponds with international tertiary education standards.
In the 21st century, every university have to realize, and most of them do, that internships program are an integral program of graduation process. Universities and colleges today must provide an opportunity for students to gain experience while at college. In Northeastern University in the United States, Boston, for instance, that is how they developed their co-op program. And now they have 48,000 students, so most students want to go to Northeastern because they have a co-op program. The objective of our internship program is to create opportunities for students to learn skills, work skills, while still at college, and for the employers to get a pool of young graduates or young students whom they can train and get the skills from.
The DSC believes its internship program gives students a head start in the competitive world of work.
When we give you the skills, you have to go out there and find jobs, but you have an advantage of other students in that you have work skills. And remember, Dominica is part of the CARICOM now on the OECS, which is free movements. A student trained at GIS can go work for St. Lucia Voice with no work permit. They can just apply for the job, they have experience, they can get hired in Grenada, St. Lucia. So there's a larger market. So our students have one advantage of other students in that they will have work experience and can work anywhere else in the region or in the world.
At least 300 students of the DSC have been placed at various organizations across the island. As of this March, 6 students assigned to the Government Information Service, GIS, have been exposed to the practical aspect of media and journalism. 18-year-old Colette Ambo, a second-year English, French and Spanish major, who intends to make her mark in the field of communication, is one of those students.
I have learned a lot of new things that are not taught at school. I got hands-on experience in an actual workplace, and I don't think I would have been able to get that kind of experience in a classroom.
However, to her, the experience has not only been educational, but enjoyable as well.
It has been great. The staff are very welcoming, they're friendly. It was different than what I expected. I expected it to be harder.
The Dominica State College says it is satisfied with the progress of the program so far and looks forward to the feedback from both the interns and organizations at the culmination of the exercise in October. The government of Dominica is now in the process of sourcing the necessary financing to restore road infrastructure, which was damaged as a result of last week's heavy rainfall. Prime Minister and Minister for Finance, Honorable Roosevelt Skerritt, in an interview with GIS News last Friday, said monies which were earmarked for other development projects will now have to be reallocated to addressing the road in Pocasset.
Clearly, these are disasters that we do not really want. It's costly. We have to now spend monies to respond to these disasters, monies that should have been earmarked for advancing the country's development. We have to now take corrective and action to ameliorate the situation. But we're committed to this task, and God willing, we will find with federal resources to respond quickly, which has been part of the operations of the state and the government. We have always responded with great speed in responding to disasters.
Public Works Minister Honorable Rayburn Blackmore says his ministry will embark on the construction of a box culvert to respond to the crater which was formed in the Pocasset Road last Friday.
We already have a design that was meant for next section of that road, and we're going to be using that design. But in the interim, what they're going to be doing is using some big culvert and to have a temporary crossing in that area so we can have vehicular traffic flow in due course. So it's a situation whereby people have to ensure that they, for the time being, avoid that area. Is indeed a disaster area, and the Ministry of Public Works and the important government will do everything to ensure that that area, that part of the road is reinstated so that we can restore that element of safety and security in that area for vehicular traffic flow and pedestrian crossing alike.
And that's news. When we come back, we'll bring you the tip of the day.
Listen closely and you will hear what climate change might sound like.
$30 for a hand of bananas?
Severe drought could destroy banana plants and drive food prices up.
And now we can see the dead coral reef below us.
Dead coral? I thought it was alive.
No, it's dead. If you look at the pictures, you can see what the coral used to look like.
Oh, wow.
Natural wonders like coral reefs are disappearing. But listen closely again, and you can hear the solution. People disposing of garbage responsibly and not in drains and rivers. People responsibly discarding engine oil. Our climate may be changing, but so can we. Making small changes together can have a huge effect on reducing the impacts of climate change. Act now. Rally, rethink, respond. This message is brought to you by the OECS Secretariat with funded assistance from USAID.
The Ministry of Education and Human Resource Development presents Math in Action, making math interesting and fun. Our master teachers will help you improve your problem-solving skills so that you can ace that exam, helping you conquer the most difficult math problems. At any level, we'll make it simple through easy-to-follow tutorials. Join us every week on the Government Information Service for Math in Action, Brought to you by the Numeracy Task Force of the Ministry of Education and Human Resource Development.
Today's tip is all about healthy eating. Healthy eating is not about strict nutrition philosophies, staying unrealistically thin, or depriving yourself of the food you love. Rather, it's about feeling great, having more energy, stabilizing your mood, and keeping yourself as healthy as possible. All of which can be achieved by learning some nutrition basics and using them in a way that works for you. Healthy eating is about setting yourself up for success. So instead of being overly concerned with counting calories or measuring portion sizes, think of your diet in terms of color, variety, and freshness. And that's all for this edition of National Focus. We welcome your suggestions and comments. Please feel free to drop us an email at gis@dominica.gov.dm or visit our website at news.gov.dm. On behalf of the entire news production team, I'm Fontaine. Thank you for watching.